Today I'm performing a secondary rhinoplasty on this young lady. What is a secondary rhinoplasty? Secondary rhinoplasty means that this woman had rhinoplasty performed by another surgeon. Unfortunately, it didn't turn out quite right for her, so she's back today for me to correct the work of another surgeon. So what are the problems here? What concerns our patient? She's been left with a little bit of a hump through the bridge that she's not pleased with. She feels that even though she's had a prior rhinoplasty, the hump is still present. So that's something I will address in the secondary rhinoplasty. She also feels that she has asymmetry between the left side of her nose and the right side of her nose. Again, even though she's had a prior rhinoplasty, she's still a bit crooked and she's a bit more full on one side of the nose than the other. In addition to which, I will perform some refinement of the tip of her nose. So, in summary, she's concerned with the persistent crookedness of her nose, the fullness of the right side of the nose as compared with the left side of the nose, and then a little bit of residual bulkiness or fullness of her nasal tip that I can refine in this secondary or redo corrective septorhinoplasty. As part of preparation for surgery, we place lubricating ointment in the patient's eyes. We tape their eyes for protection. The breathing tube is secured in place. This patient is elected to go to sleep for her surgery at our fully accredited ambulatory surgery center. Even though the patient is asleep, I am injecting numbing medicine. Why do I place injecting numbing medicine if the patient is asleep? We place numbing medicine for two reasons. One, to minimize bleeding during surgery, and two, by minimizing bleeding during surgery, we will also minimize bruising and swelling as this patient recovers from her surgery. As part of the septorhinoplasty surgery, I will be operating inside of her nose to help improve her breathing and her airway, as well as performing secondary rhinoplasty to improve the appearance of this patient's nose, who unfortunately has undergone rhinoplasty elsewhere. In order to perform surgery, the patient is painted with sterile betadine solution. That's the brown paint that we're placing on the patient. This creates a sterile field in order for us to perform surgery with what is known as aseptic technique, the technical surgical term for sterile surgery. The patient is prepared with the betadine prep solution, which is safe on the face and in the eyes, and then the patient is draped. So these are sterile drapes. I and my assistants are now sterile, and we are sectioning off or cordoning off the sterile field. So the sterile field is the patient's face painted with betadine. These blue towels are also sterile, and then drapes are applied, and as I say, the sterile field and drapes keep the clean world in and the dirty world out, and that allows us to perform surgery with minimal risk of infection or complications. In this instance, because of the complexity of this redo or secondary rhinoplasty, I will be performing what is known as an open rhinoplasty. In open rhinoplasty, a tiny incision is made along the columella of the nose. The columella is that section of tissue or nose that separates the left nostril from the right nostril. So this vertical column of tissue known as the columella is incised with a tiny incision that will heal to be imperceptible. And over 25 years of practice, I've always seen this open rhinoplasty transcolumellar incision to heal exceedingly well and to be imperceptible. In many cases, I will perform and prefer what is known as open rhinoplasty over closed rhinoplasty because, as you will see shortly, open rhinoplasty provides excellent and clear visualization of the nasal structures that allow us to perform reliable, predictable rhinoplasty time after time, achieving the results that our patients want. Interestingly, this patient who is undergoing a redo rhinoplasty by me had her last rhinoplasty performed in a closed fashion. So one might wonder if part of the complications from the prior surgery were due to the last surgeon selecting a closed approach wherein he or she did not really have sufficient visualization or ability to see exactly what they're doing. So this open approach is almost like lifting the hood of a car. We carefully and delicately dissect the skin off of the nose, allowing complete visualization of the nasal structures themselves. There are three main areas of the nasal structure. We have the upper 1/3 of the nose, which is known as the upper vault, the nasal bones. We have the middle third of the nose, known as the middle vault, and then the lower 1/3 of the nose, which are the cartilages that form the shape of the tip of the nose. As I mentioned earlier, this patient really has three problems. Number one, the nose is crooked, so that will require me to reposition the upper 1/3 of the nose, or the nasal bony vault. The second problem that this patient has is asymmetry of the right side of the nose versus the left side of the nose. In this patient, this was mainly a problem related to the middle vault, which either the prior surgeon did not correct properly or fully. So I will operate upon the patient's middle vault, or middle third of the nose. And then finally, I will sculpt the lower 1/3 of the nose, or the tip cartilages of the nose, to refine the appearance of the nose. So as shown with this open approach to the nose, the nasal bone and cartilages are well visualized, allowing me to accurately and precisely shape, sculpt, and reposition the cartilage and bones of the nose to achieve the result that this patient is looking for in her redo or secondary revision rhinoplasty. As you can see, a retractor is used to elevate the nasal skin, providing accurate and direct visualization of the nasal tissues. Rhinoplasty really involves sculpting, repositioning, modifying the cartilage and bone of the upper 1/3, middle 1/3, and lower 1/3 or tip of the nose. Here I'm seeing adding additional numbing medicine that will allow me to reposition the cartilage and bone in a fashion that will minimize bruising and swelling for the patient. So here, this arch of tissue that we're seeing almost looks like an upside down W. Those are the tip cartilages. Those are the cartilages that form the shape of the tip of the nose. These are often modified as part of rhinoplasty. At this stage, I am performing what are called osteotomies. As I mentioned, the patient's nose is crooked, and it would appear that with her prior rhinoplasty, the nasal bones either healed crooked or perhaps were never fully or properly mobilized. So I've used an osteotome, a form of a chisel, to very carefully carve the nasal bones, so that will allow me to reposition the nasal bones so that the nose will heal straight. So here the osteotome is positioned on the right side. My assistant is using a mallet to tap the rhinoplasty osteotome, and with this I am carving, in this instance, the right nasal bone that will allow me to help position the bones in proper order so that the nose will heal straight. Not shown here are the osteotomies that were performed on the other sides. The patient had both medial and lateral osteotomies performed on the left and the right side so as to reposition the bones. Here with my Q-tip, I am outlining where the osteotomies were performed, and I'm demonstrating with my hand how the bones were previously not mobilized or shaped into the proper position, leaving the patient's nose crooked after her prior rhinoplasty. So in this instance, the nasal bones have been mobilized, the bones have been straightened, and then as part of ensuring that the nose remains straight, I use a suture technique that helps to reposition the bone and cartilage and essentially internally splint the nose so that the bones will heal in place. The suture that is used is dissolvable, and the suture will dissolve in about 90 to 120 days. So this suture is providing a strong splint and internal support so I can be assured that the nasal bones and cartilage will heal straight and heal exactly where I want them to heal. Again, this suture is a tough suture that will hold the bone and cartilage exactly where I want it to be, nice and straight, and the suture takes about 90 to 120 days to dissolve on its own. During that 90 to 120 days, the bones and cartilage are splinted into place, straight as an arrow, exactly as the patient wants. I've completed the secondary redo rhinoplasty on this patient who had her surgery performed elsewhere and came to me to correct the work of another. We can see that her bridge is now nice and smooth. I've eliminated the hump that the last doctor left behind. And also, importantly, I've addressed the crookedness that concerned the patient. You can see from these images, the nose is a little bit swollen, but as you can see from the Q-tip, it is straight as an arrow. And I've also created a little bit of subtle narrowing of the nasal tip. So the patient had 3 concerns prior to rhinoplasty: crookedness, asymmetry with fullness on the right versus the left, and some bulkiness of the nasal tip, and a residual hump left behind. So I now feel that I've corrected all of the patient's concerns with this redo rhinoplasty, and I am now placing a custom plastic molded splint to the patient's nose following surgery. The nose will be taped with steri-strips to help hold it in place, and then the custom plastic splint will be placed as well. And the splint typically remains in place for 5 to 7 days following surgery, which allows everything to heal just where we want it. Importantly, many patients will ask us if I use nasal packing. I almost never use nasal packing. I'm able to avoid the use of nasal packing by some extra meticulous work inside of the nose. Patients are always fearful of packing because it's painful and difficult to remove. So greater than 95% of the time, I do not use any nasal packing in my rhinoplasty patients. This makes for a much more comfortable recovery period, and they're able to breathe nicely following surgery. Here the nose is taped, and shortly a splint will be applied, and the patient will be comfortably and safely whisked off to the recovery room, where they'll typically remain for about 1 hour before heading home. I also ask you to note that even after this complicated revision rhinoplasty surgery, you see almost no bruising and only a tiny bit of swelling. This is due to meticulous technique, experience, and some very special things that I do during rhinoplasty to help minimize swelling and bruising following surgery for my patients.